Welcome class to Surgical Procedures 1, 1441. This is chapter 10. We're under the classification section. And for this video, I'm going to focus on 4 different types of instruments that fall into this classification. In previous videos, we've gone over like one type per video, and these are really short, so we'll go over them quickly. So we'll go over probing, dilating, and suctioning, and microinstrumentation. So I am using pages 251 and 252 and 253 for those items. Of course, I'm using my surgical technology for the Surgical Technologist 5th edition Positive Care Approach book. So we'll begin with probing. I don't have a probe to show you other than what is in this book. I'm going to try to pick it up and not drop all my other places that I have saved. This is not this is not the same instrumentation book that you guys have. However, it's pretty similar, so I left my other one at home. And I've already lost a page. Alright. So, the first category of probing, there's something called a Bowman lacrimal probe. And they come in different sizes. They're really tiny. They're intended to go into the lacrimal duct. And they're actually kind of similar to this, which we'll talk about here in a second, because they're malleable, so they'll bend like those malleable ribbon retractors we were talking about. But even though they're a lacrimal probe, they are also, I've seen them used a lot with like pilonidal cysts, where they may need to track to see where the infection is going, and so they'll take these probes, the long thin end, and they'll track it to see how far the infection has gone into the body. So they're tracking it by seeing how far this probe will stick down. So that's an example of a probe. Now moving on to dilating instruments. There are several out there, but the whole purpose of the dilating instruments is to make a smaller hole bigger. And you don't want to just shove some sort of big dilator into a hole that wasn't meant to be this big. At least not right then and there. You'll stretch it out, you'll rip it, you'll damage the tissue. But it's better to start with a smaller end and then work your way up to the larger end. And so always start with the smallest one, the smallest probe, because they will come in a set of, I don't know how many are in there, but it's several. They'll come in a set of several of these type of dilating things, instruments, and you'll always start with the smallest unless otherwise advised by your surgeon. And what you will do is you will communicate with your surgeon what you're giving them. So the surgeon says, all right, give me a 12 or 11, give me an 11 dilator. Okay, so on here, there's these little tiny marks, and I don't think you're going to be able to see it on the camera, but in person you can. This says 11 right here. So I know that I'm going to say 11, and I'm going to communicate that with my surgeon and hand that to him or her. They'll use it, and more than likely they'll flip it around and stick the 12 in there and give it back to you. And then you'll come and you'll do the 13, and you'll say that 13, and then they'll do 13, and then they'll do the other side 14, and then so on until they tell you to stop. So there's different ones out there. This one that I was using as an example is the Hanks dilator, and there's another dilator called the Hagar, Hegar dilator, and the main difference between these two is that you've kind of got this little bump thing here, and that's how you're going to tell the difference on those two. So Hank, Hagar, they are both cervical dilators. So they dilate the cervix. There is another dilating instrument I'd like to show you, and that's these. These are called Garrett dilators. They also come in smaller to bigger sizes, and so and they come with many of them together. And these are actually more of a vascular dilator, and they do look like a probe, but they are categorized as dilators. And you can use these to dilate arteries. In the book, it specifically says coronary arteries, but you can use them to dilate other arteries. It doesn't have to be in the did I say cornea or coronary? I don't know what I said, but coronary. You can use them in arteries in other places than the heart. Okay, so those are Garrett dilators. And let's see if there's any more worth mentioning. There are also urethral dilators, and you do use a different one for the female versus what you would use for the male. And the female ones are shorter than the Van Buren urethral dilators for men. I don't have any of those to show you, but believe me, you're going to see them at the clinical site. There's even something called a bougie dilator, and it's Bougie, and it's an esophageal dilator. And so it's going to go down the mouth through during surgery, intraoperatively. And they come, once again, in different sizes, and they're small to large, and you start with a small one. It's not uncommon to use KY with dilators, whether you're using the cervical or the urethral or these bougie dilators. You wouldn't necessarily use them with your vascular dilators, but with the others you might. Probably should, unless you don't like the person. Just kidding. But anyways, these bougie dilators, they are very long, and they're very flexible, and they go down the esophagus, and you can slowly dilate them. They're not considered sterile. They don't need to be sterile. They're a semi-critical item because they're going through an orifice, a naturally occurring orifice, instead of an incision in the body. All right, so that's enough, I guess, on dilators. The other thing I wanted to go over with you is suction tips. There are plenty of suction tips out there. We're going to go over 3 today, and that's it. But believe me, we'll hit on some more in later chapters. So your most common one is going to be this yank hour. And so I have a metal one here. They also come in blue plastic, and to be honest with you, with your clinical sites here, you will mostly be using the blue plastic ones. The blue plastic ones you throw away. These have to be reprocessed in central processing and sterile supply, okay? And right here, it hooks to a suction tubing that will hook to a special suction device that will help bring the suction, and then this is what you suction up with. So this is your typical basic. You're going to use this on most of your cases. If you are in a case where there's a lot of fluid, you will need to use this pool suction, Poole. This is the tip that hooks to the tubing, and this is what suctions in. So as you can see, it's got all these holes here. These only had the holes here at the tip. This has a lot more. This is going to allow for you to suction up a lot more fluid at the same time versus this. So do you need this all the time? No, you just need it when you're using a lot of fluid. So let's give some examples of that. Number 1, trauma. If someone comes in and they've had some sort of internal damage because of maybe an MVA, motor vehicle accident, or something like that, they may be bleeding in their abdomen, and when the abdomen is opened for an exploratory laparotomy, it could be filled with blood. And you can't, the doctor's not going to be able to see what they're doing if the abdomen is filled with blood. So what they do is the very first thing you should have ready in your hand to go while that surgeon is opening up that belly, because this is probably going to be an emergency, is have this ready to go and start suctioning up as soon as fluid starts coming out. If needed, you can get 2 of these. You'll have to have 2 of these and then 2 suction tubings as well if you've got that much blood. In a trauma, go ahead and be prepared and have that stuff ready to go. But anyways, so you can use these and suction up the blood. Another time you might use this is towards the end of a case. Oftentimes with open abdominal procedures, before the surgeon closes up, but after they are done with whatever they're doing, they will pour in warm, sterile saline into the abdomen and kind of wash it around and just kind of make sure they're cleaning it out, and also making sure they don't have leaks and that there's not other debris, and they're doing a lot of things with that. But they don't need to leave that saline in there forever. So what they do is you will switch out your suction tips from this to this briefly until they're done washing the abdomen, and then you're done. So this comes apart. And now you've only got one little hole here. I'm sorry. Okay, so there's 1, 2, and then there's a third one at the very tip. For vascular procedures, when very precise suctioning is needed, such as a vascular procedure, they may request that the guard be taken off and this be used for precise suctioning. So anytime that you are doing a surgery where a cavity is entered, such as the abdominal or thoracic cavity, you're going to have to count your instruments. You don't have to count your instruments for every single procedure, just the ones where you're going to enter a cavity, or unless requested. So, by the doctor. So, my point that I'm trying to get across to you is this came apart into 2 pieces. This should be counted as 2 pieces, not 1. All right, so we've done our yank hour for basic everyday stuff, our pool for heavy fluids, and then the other one I wanted to go over is a Fraser suction tip. So this is what I had here in the lab. They're angled, they're small, they're also for precise suctioning, and then they have these little holes on them. So this part hooks to the suction, and if the surgeon is suctioning and they want a little more power in their suction, they're going to have to cover this hole with their finger or their thumb, and it will add a little bit more power to the suctioning and suction things. But you would use these for delicate procedures, vascular, ENT, neuro, and they come in different sizes. I've got some relatively small ones here. These are actually 2 5s, but they look different, right? Like they've got, like, one tip is shorter and one tip is longer. They're not supposed to be bent like this. Like, do you see that? This is what happens to instruments when you don't take care of them and you set heavy instruments on top of delicate instruments. It ruins them, and then I get them, which is fine. I like free stuff. But anyways, these are both 5s, and probably what you're going to see more often, especially like in neuro, is like a 12 or a 10. And even though the 12 and 10 are bigger than these 5s, in fact they're double the size, they're still not going to be super big. Because these are so narrow, regardless of whether you have the 5 or the 3 or 7 or 10 or 12, there are times when they get clogged up during the case, and you can unclog them a couple different ways. One way is to use this stylet. It's just a wire, and they're supposed to come with the Fraser suction tips. And what you can do is you will put this wire, this one's too big for this particular suction tip, but you would put this wire through and it would push out any debris that might be there and hopefully help it. Another thing you could do is fill up of course everything's got to be sterile because this is intraoperatively in the middle of the case. You can take a syringe, and you're always supposed to have like saline or water on your back table, and you can draw up some of that and then put your hand over this hole, And then you're always going to have like extra buckets and stuff on your back table too. And what you can do is take that syringe and carefully push it through, and it'll also push through any debris. So there's two different options there for cleaning these. I would start with the stylet because it really sucks when you're doing the syringe thing and then you do it too hard because you're in a hurry and just squirts everywhere. So you gotta be careful. So those are the Frasers, and those are the three different suction tips that we're going to talk about now. So Fraser, Yankauer, pull. All right. I also want to go over microinstrumentation. I don't really have anything fancy to show you. Micro means small, so small instruments. Delicate surgery, this might be surgery on the eye, or delicate brain surgery. There's ear surgery, anything where a microscope would also have to be used. And so, of course, if you're doing delicate microsurgery, you're going to have smaller instruments. And these are just some examples of smaller instruments. And it is ideal to use this titanium. This is the blue. I know it's mentioned in your book. But this titanium is strong, but it's also lightweight. So, and it's dull too. In the microscope, there's going to be a light that's going to have to shine in there, and if you've got a super shiny instrument, that's going to make it really difficult for the surgeon to see. But with this titanium, it's a little duller, or more dull, I don't know what's right to say, but and it's not going to shine as much on this as it would like a really shiny stainless steel. Okay, and I believe that is it for the three sections, for probing, dilating, suctioning, and microinstrumentation. So 4 sections. Okay. All right. I'll see you later.